Hi everybody, thanks for joining us. This is David Ritchie with Ritchie Limb and Brace here in New Braunfels, Texas. Today I want to talk about a common problem that amputees have in dealing with their liner. No one likes to take off their liner and have a really bad odor coming from that liner, and unfortunately the gel systems that a lot of us use these days to hold the limb on, they retain bacteria. All the sweat that you produce during the normal course of a day, skin sloughing off of your body, it's a haven for bacteria to form, and as many times as you wash this liner, antibacterial soap, using alcohol, the like, it just doesn't always take care of the problem, and you always end up with a residual odor smell that smells like a dirty locker room after you take your silicone liner off, and nobody likes that. Well, I want to talk to you about the Ross system. The Ross system is a disinfectant machine that we have here. It generates ozone within the machine, and it actually kills all that bacteria. So when you get the liner out, it comes out smelling so wonderful. It kind of smells like the chlorine in a pool. Here at my practice and in the Seguin practice as well, we have these machines that are free to use for all of our patients. Anytime I have a patient coming in for a follow-up, if they're here for an adjustment, or they can just stop by and ask us to disinfect their liners, they can sit in a room. It takes about 15 minutes to disinfect your liner while they wait. And we can do both liners because we have two machines at the New Braunfels office and one machine in the Seguin office, so it doesn't take that long. So let me show you how this works. Essentially, you've got your liner. We just do a general washing on the inside, kind of get rid of the bulky stuff. We're going to take the top off of this, and we're going to put that right inside of here. And so the liner will stick right there, and what ends up happening is you just push the button. Normal sanitation takes about 15 minutes, and you'll see the lights as they march around, and it'll beep when it's all done. So for people that have, residual limbs that are real sensitive, so I have one of my patients has eczema. With eczema, there's a lot of sloughing going on, and he has to keep on top of the cleanliness of his liner, and no matter what he does, he just can't get rid of all the bacteria. So it's very important for him and anyone with that condition to keep your liner super clean, because if bacteria gets onto your skin, it can cause an infection, skin rashes, folliculitis, God forbid, a more aggressive infection. So keeping your liners clean is something that you always have to do. And unfortunately, it's one of the least things we like to do because it's kind of a hassle. You take your liner off and you're tired after you've been out all day. Just rinse it off, give it a good washing, stick it in the Ross, and let the Ross do its job for you. I would recommend, if you have a Ross, you could disinfect this liner at least once a week, sometimes twice a week. It's really an effective tool for amputees to take care of the health of the residual limb. Okay guys, thanks for tuning in. I'm glad I was able to tell you about the Ross. You can go to our website, www.gotlimb.com, here in New Braunfels, Texas. Ritchie Limb and Brace, closing out.